My name is Joe Anne Ward. Oh, I was going to tell everybody. So my name is Joe Anne Ward-Cottrell. I am with WellSpan Community Health. If you're not familiar with Safe Kids York County is part of a worldwide organization. WellSpan Health, in particular, my department, Community Health, is the lead agency for Safe Kids here in the county. I'm a coordinator, and the co-coordinator is Alice Price. She's the kind of the Oz behind the scene today, making sure all things technical are being taken care of, including she changed my name. So a few that obviously I didn't do. So a few of the housekeeping pieces. Alice is taking that. So the this Lunch and Learn is part of a bigger initiative that we were very fortunate to receive some funding from Safe Kids PA, a grant with funding through the Pennsylvania Department of Health to do several things and related to medicine safety. So we are taking attendance and wanting to make sure we're accurate in that, and then accurate in collecting just some feedback at the end of the Lunch and Learn. So to help Alice with attendance, if your name is different in your sign-in, I know for a while when I used my personal computer, my name came up as Ernie all the time. If you could change that for Alice, and if that's difficult, if you can't figure out how to do that, just in the chat, put your name so we can make sure we are, counting noses. And if you have other people sitting in the room with you, if you could be so kind to add their names and email so that we can make sure we get feedback from everyone. And then, on the end, when I send those, those surveys, they could also be passed along. But we just want to make sure we count all the noses of the folks that are joining us today, whether they're the one that signed in or somebody else in the room. So I think that's a bit of the initial housekeeping. We'll ask that you keep on mute, obviously, but we'll be able to stop and ask questions along the way. If so, feel free to jump in with a question. There'll be questions at the end. So with that housekeeping taken care of, I am very pleased to present that our presenter today is Dr. Elizabeth Bowden. Dr. Imboden has been a friend of Safe Kids and our department for a number of years, and has just been tremendous in terms of being able to share information with our community partners. Dr. Imboden is the chief of pediatrics at WellSpan York Hospital and is a pediatric hospitalist. So with that as an introduction, Dr. Imboden, I'm going to give you the show.
All right. Thank you, Joanne. And thank you all who are taking your lunch hour to join us today. I hope that this will be very informative and that you'll take pieces away that you can kind of take back to the families that you are interacting with on a day-to-day basis. As a pediatric hospitalist, I see the effects of kids who haven't had safe medication storage at home. So that I think this is certainly very relevant. And I'm going to kind of start with a little case. And this is not I should say it is typical of some of the things that come into our emergency room. So this was about a year ago. Was called down to see Julius, who is a 2-year-old that mom brought into the emergency department after he was found playing with his grandfather's pill pack. And this is sort of what his pill pack had looked like. And, this is one of those ones where grandfather was visiting the family. And this was in grandmother's purse, and grandmother's purse is on the floor. So no one's really thinking none the wiser. So it's sort of like, surprise, look what I can do, because he was able to open up the blister packs. And when they found him, he had multiple pills were missing from the blister packs, pill fragments removed from his mouth, as well as multiple pills kind of scattered around him. And one of the fortunate things is when they brought the pill pack in, we could know exactly what medications he had taken. which included an antihypertensive and an anti-diabetic medication, which unfortunately are medications that are very dangerous when ingested by children. And with this combination, he actually was required to be transferred to a tertiary care center because of the significant risks of effects from these medicines. And I think this case kind of is a good jumping off point because it highlights a couple of things that we'll kind of talk about. One is, whose medicine, where's the medicine coming from, and where are we keeping our medicine? And some of the things we kind of take for granted in our homes and things to bring up to our families. So in 2012, Safe Kids Worldwide became interested in this accidental unsupervised ingestions and medication errors. And they developed a set of kind of call to action processes that they put forth and implemented. And as you can see, since 2012, when these things were put out, we've seen a significant decrease in emergency department visits. Unfortunately, just like Julius, he is one of 115 children under the age of 6 that are seen in the emergency department every day. And while the trends in hospitalizations have also gone down since the initiative in 2012, we still are seeing about 21 children under the age of 6 hospitalized every day because of these accidental unsupervised ingestions. And if you look at the calls to poison control centers, well, there's maybe a slight decrease in the subsequent period. We still see a fair number of these calls. And in fact, there's approximately 1,100 calls to poison control centers every day. So we still have a lot of work to do. And as I'll kind of talk about, single substance can be a deadly thing. So what do you need to know about patient safety? I think one of the biggest questions that comes up is, well, what do we mean by medicine? And it's interesting that when I ask families, and I'm taking a history, I may ask a family, so what medicine is your child on? And it's interesting what the response is. I often will get answers that just involve prescription medications. People don't think of over-the-counter vitamins, herbal supplements. Even in some families, they don't even consider oral contraceptives a medicine. So it's very important to make sure that we stress that medicine is prescription, it's over the counter, it can be eye drops, it can be diaper creams, it can be Bengay. Those are all really medications. And what we found is that there has been a dramatic increase in the amount of medications in the home. And that's both over the counter as well as prescription. And it was interesting that a study looked at over the last 2 decades, the number of prescriptions filled has increased by 142%, while the population itself has only increased by 22%. That's a lot of prescriptions for people. And if you look at over-the-counter medication spending, they've actually shown that since the 80s, there's been a 5-fold increase in the amount of money that's being spent on over-the-counter medicines. So if you add those 2 things up, that leads to knowing that in a household, there is a lot of medication. And if there's a lot of medication, that means there's a lot of potential exposure for children. And so why is it important to keep medicine safe? Because if you look at it on an hourly phase, about every hour, there are 5 young children under the age of 6 who are ending up in the emergency room because they got into medicine. And this is just the accidental medicine. And these are patients who got into it because they weren't supposed to, not because they were, or I should say, supposed to, or given the wrong dose of the medication. And the scary thing is that it can take just one pill to cause significant harm to a child. These are some of the medications that literally one pill can kill. And so with, particularly as we get into looking at who the medications are that kids are getting into, a lot of these are medications that may be found in some of our older population. And when we look at among the children who are the biggest at risk, it's probably not a big surprise that it's really the younger children, ages 1 to 4. Why is that the case? Well, for a couple of reasons, but one particularly is those are the explorer age. Part of their development is they learn about things through their environment. They like to put things in their mouth. They like to touch things. They like to see how far they can reach. And so they got their little hands into just about anything. And it's amazing how quickly they can get from one place to another. And in fact, if you look at the highest number seen in the emergency department, it's really the 1 to 2-year-olds that out of 10 visits to the ER, for every 10 visits, 7 of those kids are between the ages of 1 and 2. As far as the older teens, the reason why they are more at risk, one is that they are now at the age where maybe they're self-medicating. They are having access and taking more of the over-the-counter medicines. They also are a population that we may unfortunately see more intentional ingestions of medications. And as you all are probably aware, we are seeing a dramatic increase in mental health concerns around our adolescents. And that has led to increasing incidences of non-accidental ingestions. And then, so we have all this medication in the house. Whose medicine is it? You know, we used to think of it as mainly being parents or siblings, but we are seeing more and more that grandparents are a presence in the home at a larger degree than ever before. The CDC, along with the AARP, did a study, and they looked at the children that were treated in an emergency department for medication exposure, poisoning, and 38% of that medication in those cases was found to be from the grandparents. If you look at households, we're seeing a shift that there is a doubling of grandparents as being considered the head of household since 1980. And 2 and 3 grandparents are caring for children at least one time a month. And if we think about the exposure, grandparents being older, your chance of being on medications, even multiple medications, also is at puts children at risk. And the medications that kids are getting into, probably not surprising, given that most of the medications that we're familiar with in having present in most everyday households, pain and fever remedies are kind of number 1 when we look at the medication that kids are getting into. That's your Tylenol and ibuprofen. Actually followed by diaper rash products. So something that most people don't think about as being quote unquote a medication. And then you think about your vitamins and then allergy medicines kind of top the list. But we can't forget about the other things such as vapor rubs, and camphor is particularly toxic for children, laxatives and eye drops. In older teens, the types of medicines that they would be coming in for are kind of similar, but an additional medication that has been seen in higher numbers for adolescents is actually anti-anxiety medications. We've had children who thought that, well, if one pill is used for being to help with my anxiety, if I take multiple, maybe that will help even better. So kind of that misunderstanding of things. And then where do kids find the medicine. As in the case of Julius, it was in the purse of grandmother. But the most common locations are going to be pillboxes and actually on the ground, followed by the counter and then places like the refrigerator. And actually, over half of medications have been found to be stored in unsafe places. And the problem is, if you aren't storing your medication properly, kids can get into it. And if any of you have looked at some of the medications, you can see why a child might have confusion, especially older kids who maybe have a little bit more awareness and could differentiate. Well, things can look very much like Skittles or some of their candies. So we are very conscious that we need to keep these medicines out of reach, even for the older kids, because they don't know any better. So storing medicine safely is really crucial and important. And when you ask families, what does storing medicine safely mean? You may have mixed messages, or mixed answers to that question. You know, what it really means is not just out of reach, but it needs to be out of sight. And that's every medicine, even the medicines that you need to take every day. And while we know that having them where you can see them may increase your reminder to take it, having it where you can see it increases the chance that children may try to reach for it. And it's inconvenient, but it's the safest thing that we can do for our children. And if you look at what parents say when they come into the emergency room for these medication poisonings, often the phrase is, I only turned my back for a minute. I went to answer the phone. I just went into the other room. And a third of parents believe that if they are watching their child, they do not need to have medicines in a safe location. And as we all know, you know, especially if you have multiple children, it's impossible to keep your eyes on everyone. So you can never be too careful as far as the storage. And we know, going back to the development of children, they like to climb, they like to explore, and they like a challenge. So it's amazing how ingenious kids can be to get something that they want. If they see something on a counter, you may think it's out of reach, but they can suddenly find something to pull over, step up, and get it before you realize. So out of sight, out of mind. A lot of people think, well, the packaging will be what is the safety valve. And you hear the term child-resistant packaging. And we need to remember that child-resistant does not mean child-proof. And when you look at the definition of what child-resistant packaging is, this is the definition: significantly difficult for children less than 5 years to open within a reasonable time, and not difficult for a normal adult to use properly. So child-resistant packaging is not child-proof. And we know that almost half of accidental medication poisonings involved child-resistant packaging. So do not be kind of fooled by thinking you're safe with having that child-resistant cap, which sometimes for adults is harder to open, and we can often get the kids opening it easier than we can. One thing I wanted to kind of put in here around getting into bottles is a recent report around melatonin poisoning. And this was particularly interesting because just since the pandemic, there was a 530% increase in kids accidentally poisoned by getting into melatonin. And especially the children less than 5. Unfortunately, they didn't really come up with an explanation as to why. I suspect that, there's more melatonin being out there, people needing to get more sleep because they're anxious and having it around. But this was a one marker of what's happening in some of our ingestions out there among a product that a lot of people feel is kind of relatively benign, but it does lead to hospitalizations, and there have even been deaths related to overdoses of melatonin. So out of reach, out of sight every time, because children can't eat what they can't find. So we talked about medications, putting it in a safe place, up out of reach. One of the other areas that often is kind of overlooked is how we give medicine. And we have medicines that have labels that are fairly easy to follow. They usually come with their own measuring device. And it's really important to know a couple of things. One is you should always use the measuring device that comes with the medication. It's also important that if you're giving multiple over-the-counter medicines, to read the label. A lot of families do not realize that some of the cough and cold medications with multi-ingredients could also have Tylenol, which if they're giving Tylenol separately, you could give too much. So reading the labels, knowing what you're giving the children, and also being aware of what the side effects are. And we know that people's schedules are very hectic. Families are often coming and going. We may have shared families, homes where maybe there's grandparents coming in and taking, maybe they're going to babysitters. So trying to keep track of who's giving what medicine can be very challenging. And this often can lead to children either getting multiple doses erroneously or getting too high of doses. And one of the recommendations can be, particularly for families where there's multiple people who may be expected to give the medicine, is to keep a schedule. That way you can make sure everyone knows what medicine, what time, what amount, and there's not a question of double dosing because you didn't think someone gave it, and everyone can be on the same page. And then the other thing can be, there's now lots of apps to put on phones. You can set reminders to kind of either remind to give the medicine, maybe sending a text to say, hey, I gave the medicine, so everyone's kind of on the same page. There's been numerous times where we've had families come in because multiple people gave a medicine and they didn't realize the other person had given it. So always encourage families. There's people available to answer questions about medicines, whether it's the primary care doctor who prescribed the medicine or can answer questions about over-the-counter medicines. Pharmacists are very readily available to answer questions when you pick up a medicine or even if you are just in the pharmacy. And when there is a concern about whether you've given too much, taken too much, or just unsure, the Poison Helpline is a wonderful resource. When should families call the Poison Helpline? Really, if you have questions about the amount of medicine that you gave, perhaps you did have 3 people that gave the dose of medication. If you call the Poison Helpline, they can calculate based on what you tell them if it's a concerning amount or not. They can also give direction as to, is this something that you can monitor at home? Is this something that needs to go directly to the emergency room? Is there any other special precautions or things to observe? If there is any concern about child's breathing, color change, seizures, collapse, that's an automatic 911. We do know, as I mentioned, that there are certain pills that literally one pill can be life-threatening. And recommending having that poison helpline saved in the phone, put on the refrigerator somewhere where it's easily accessible. And they are available 24/7. So there is always someone available. And what's very nice for when children are directed to the emergency room, we are able to contact not just the poison line, but toxicology. We have the ability to reach out to have exact recommendations based on the medications that children have taken as far as the monitoring. So a lot of medications are at home. Some of these medications will be, again, over the counter. Maybe they're expired. Maybe you have finished a prescription or were told to stop it and you have leftover pills. So what we don't want to have is medications lying around and available. Sometimes families forget that these medications are even in the house until the children unfortunately kind of come across and find them. So there are a couple options for where you can get rid of medications. This is an image of the MedSafe that's actually at York Hospital right outside the pharmacy. And this is wonderful for families that any kind of unused medication you can bring and dispose of here. There are also community take back events that can also be used for families to kind of dispose of medications that they are no longer taking or needed. If you're at home and you don't have access to coming into the pharmacy or a community drop-off location, there's a couple things that can be instructed for families of how to get rid of their medicine safely. Mixing medicine with things such as dirt, coffee grounds, or kitty litter. It's important that the medications be mixed with something disgusting. In the event that somebody would go through trash and try to find the medication, this will make it so that there's no desire to use it. Take it and seal it up then in a container or a bag, and then throw it in the trash can. You do not want to be flushing it down the toilet. We really don't want this in medications in our water system. So this is a better way to dispose of medicine if you can't get it to a drop box. And removing that personal information just in the event that somebody is going through the trash. This is really important. We think, families think of who's in the house most of the time. And maybe everybody in the house is really good about medication safety. But remember, there's people who come to visit, whether it's friends, guests, grandparents, aunts, uncles, caregivers. Everyone should be informed on medication safety. And I can't stress that enough, particularly when it comes to grandparents. I think from my experience in the emergency department, that's been a lot of medications that I've seen kids get into. And a lot of it is just not realizing that those medications, when they're in the purse, and a lot of people will keep them in a Ziploc bag or something that's easy for them to get to, because maybe, for instance, they have arthritis and it's hard to get the cap off. So they make it easy for them, but then they forget when they come to a home where there's children that those little hands can kind of get in and find things. So sharing this information for anyone who's kind of going to be involved in the household. There's a few safety resources, and maybe I can have Joanne, did you want to speak to these available opportunities?
Yep, I'd be happy to. So Safe Kids York County has a variety of resources available. And as I mentioned, following this, the session, probably not until tomorrow, we will be sending out to you an an email with a survey, and in that though, I will go ahead and attach some items that are easy, PDFs, easy that pretty easy that you could download, copy, if you'd like to use them. We also, so those same parent tip sheets, we also have in like little tear off pads. So there are going to be some of these the items that you see here that in that survey will ask you, if it's something that your agency would be interested in, and we can provide them to you. So the tip sheets, it will be easy downloads, or you can request some from us. Mini posters, the two images that were part of Dr. Imboden's presentation, the candy confusion, where you see the lookalikes, and then an infographic that shows how many children go to the emergency room by swallowing things, medicine versus household cleaners, coins, things of that nature. We have those in 8.5 by, here we go.
It would be easier for me just to let's see. It's coming. There we go.
Ta-da! So we have these in like a slick poster paper. They're about 8.5 by 11, so they're not huge. They wouldn't take up a lot of room. But if that's something that you would like to be able to post in your agency, we'll be including that a request for those items as part of our survey. Then the other, now I'm going to have to, as you switch back, Dr. Imboden, I'll try to remember. We also have a PowerPoint presentation similar to this one, but with not as much of the statistics and so forth in. So if you want to feel comfortable and you wanted to do a presentation for families and any, and use a PowerPoint presentation, we'd be more than happy to provide the handouts and the enterprise presentation as well. As well as obviously we're available to make those connections as well. So tip sheets, posters, we have that PowerPoint. I can also make available social messages, social media messages and pics that you can put out. And there's also some very interesting videos that Safe Kids Worldwide has available that we can make available to you. We also have limited supplies of then some more intervention materials, locked medicine bags and cabinet locks, baby gates, things of that nature. So we have resources available. We also work with the York Opioid Collaborative. They also have storage bags, lock bags for medicine, but their safeguard kit also has the medicine disposal kit in it. In lieu of the kitty litter, this is a little kit that would then help dispose of the medicine. So if you're interested in that route, the York Opioid Collaborative, that website has links on it if you for a couple of things. So if you look, I think under resources for health professionals, you'll see the form to request these items. And then the other thing that I want to bring to your attention is that I believe under the resources community, you can also find a list in York County of all of the different places that have those the medicine box that Dr. Imboden mentioned. There are a number of police departments. There's also a couple of pharmacies on there as well. Dr. Imboden mentioned the York Hospital as well. So that information is also available. And we've included Brittany Brittany's phone number is the contact. And you can email her through the collaborative if you're interested in learning more. You can email myself, Alice, for more of our information. But like I said, we're going to initiate an email to all of you, and then we can kind of talk back and forth if you're interested in using any of the resources through Safe Kids York County.
So I think to kind of wrap up kind of key things, I think it's important to remember that the medicine needs to be up, out of sight, in a safe place. And that, too many times we make assumptions about what our kids will and won't do. So just assuming that they can get into everything is the best thing. To remember that child resistant does not mean child proof. So don't be fooled by the caps and think that those are secure and that you can have the medicine out on the counter because it's child resistant. And to make sure that we encourage our families to share safe storage of medicine with everyone that the child may be interacting with or coming into the home. Sometimes that can be a very difficult conversation and people may not feel comfortable bringing that up. But I think in situations that I've seen, if people had just been a little bit more forthcoming and particularly with visitors, purses, coats, bags, everything up where the kids can't reach, and just make the assumption that they can get into it because, you know, where there's a will, there's a way. And that while we've made good progress, we still have a ways to go in keeping our kids safe. And that whatever we can do to kind of share that and prevent another child from ending up in the emergency room or worse, dying from an ingestion, we need to share that with our families. I will now open up if anybody has any particular questions, comments, either put them in the chat box, or I'm fine if you guys want to unmute and ask away. And if no questions, I will turn it back to Joe Anne.
Thank you. So as I mentioned, you can expect an email from us. Very brief questions as feedback, and then the opportunity to let us know if there's some resources that we can help you with. So we very much appreciate your completing the survey. As I said, it helps us for our grant reporting, so we appreciate that. And I should, since we have time to spare, I should also mention, if you're new to Safe Kids, Safe Kids York County, this is an initiative that, because of the situation, you know, the ongoing concerns with children getting into medicine, because more medicine is the home, we've kind of upped our kind of, you know, upped our involvement and trying to do a little more things and reach out to more agencies with that information. But some of the other activities, some of the other key components of Safe Kids or activities of Safe Kids York County is child passenger safety. So our office, the number that you saw, and when you get our information, you'll have it. Our office helps to coordinate child passenger safety inspection stations throughout the county. So if you call the Safe Kids York County number, we can connect or share that number with families. We can connect them to the closest inspection station. And we also manage an inspection station. Alice is the coordinator. So car seats can be checked at our office. We are also checking car seats at several OB office, WellSpan OBGYN offices across the county. So we're trying to make them a little more accessible. And we manage the Safe Kids York County's program, car seat distribution program, low cost car seats available to caregivers, to parents, and caregivers if like a grandparent, for instance, has custody of their grandchild, who are on some kind of assistance program, you know, CHIP, WIC, what am I missing? Medicaid, any kind of Medicaid kind of package. So that's another key program that that we manage out of our Safe Kids office. Just want to make sure everybody was aware of that resource. And I say that because since COVID, families aren't calling to get their car seats checked. So any kind of encouragement, along with keeping the home safety, we want kids to be safe at home, at play, and on the way. So we want to make sure that they're buckled up properly as well. So thank you all for sharing your lunchtime with us. Thank you, Dr. Imboden, for sharing not just the information, but I think, you know, the fact that you can tell us that while we're reading this information and seeing these statistics that's collected by Worldwide, you're seeing it. You can tell us exactly what you're seeing right here in our community. It is real. It is very real. So thank you. And everyone have a good rest of your day. Thank you for joining us.
Thank you. Have a good day.
Bye.